Benign prostatic hyperplasia is a medical condition in which the prostate gland enlarges. This is caused by an increase in the number of cells that make up the prostate. It is important to note that these changes are not cancerous. More precisely, benign prostatic hyperplasia is not cancer and does not increase the risk of prostate cancer. The cause of prostate enlargement is not clearly understood, but one of the factors that may be responsible is excessive activity of sex hormones. I am referring to both testosterone, specifically its active form dihydrotestosterone, and estrogen. These hormones bind to receptors, which are certain sites located in the prostate gland, triggering the growth of prostate cells and causing the gland to enlarge. However, this is only one of the main hypotheses. I will not mention the others as they are not relevant to the content of this video. What is known is that this disease is associated with aging and its progression increases with age. It is estimated that benign prostatic hyperplasia affects approximately every other man over the age of 50. Of course, the problem can also occur in younger people. Now that you know what benign prostatic hyperplasia is, I would like to say a few words about the symptoms it can cause. These are mainly due to the enlarged prostate pressing on the urethra, through which urine is transported. There may also be disruption of the so-called voiding muscle, which is responsible for removing urine from the bladder. The most common symptoms of prostate enlargement are frequent urination and nocturia, which is the need to urinate at night. Such episodes can occur 3 or 4 times a night and in some cases even more often. There is also often a sudden urge to urinate at a narrowing of the urine stream, sometimes to the point where it is released in drops. In addition, micturition or urination may be accompanied by burning and pain. When discussing the symptoms of prostate enlargement, it is also worth mentioning that there may be involuntary leakage of urine from the urethra at the end of urination. Patients with this condition also report difficulty starting urination and a feeling of incomplete bladder emptying after urination. At the same time, it should also be noted that in some cases untreated prostate enlargement can cause various types of complications and health problems, such as an increased risk of urinary tract infection and the development of kidney stones. In extreme cases, there may also be hematuria and the development of kidney failure. Furthermore, the aforementioned disease can disrupt sexual functions and lead to impotence. However, as I mentioned earlier, prostate enlargement does not cause prostate cancer. As you can see, prostate enlargement is a condition that can significantly reduce the quality of life. Furthermore, if we do not take action, the condition can worsen and cause the aforementioned complications. Therefore, I believe it is worth taking action in advance and using certain natural methods that could stop this unfavorable process or even reverse it to some extent. Of course, when it comes to treating prostate enlargement, we also have pharmacological and surgical options. However, if possible and justified, I prefer to use natural solutions first, as compared to some of the drugs used for this problem. Natural methods usually do not cause side effects. And it is about these methods that I would like to talk about now. Recent research findings published in 2021 show that vitamin D is a very important component in the case of prostate enlargement. Experts have clearly noticed that the use of vitamin D resulted in a beneficial decrease in the size of the prostate, as well as the alleviation of symptoms associated with the condition. Scientists believe that this action of vitamin D is due to its strong anti-inflammatory properties, as well as its influence on the activity of various genes that may be involved in the development of this disorder. You may be wondering how much vitamin D was used. Participants in the study received 50,000 units of vitamin D3 every 2 weeks for 6 months. Of course, there can be different supplementation schemes for vitamin D. It all depends on the initial level of vitamin D in the body and how the body responds to supplementation. For some people, relatively low doses are enough to achieve and maintain the correct level of vitamin D, whereas for others, the amount of vitamin D taken must be higher. Personally, I am in favor of taking 2 to 10,000 units of vitamin D per day. But as I said, the specific dose should be tailored to the specific case. Furthermore, such effectiveness was not only noted in this one study, it was confirmed in many other scientific works. Therefore, the conclusion is that supplementation with vitamin D is a must in the case of prostate enlargement. Scientists have shown that zinc is also a valuable component of the diet in the case of an enlarged prostate. In many experiments, their authors noticed that, similarly to vitamin D, providing high amounts of zinc caused a decrease in the size of the prostate and a reduction in symptoms associated with this condition. Researchers suggest that this effect is caused by zinc influencing certain enzymes, which inhibits the transformation of testosterone to its active form and prevents testosterone from binding to receptors located in the prostate gland. This is particularly important as I said at the beginning of the video, binding testosterone to these sites can lead to the enlargement of the prostate. Lycopene, a biologically active compound found mainly in tomatoes and tomato-based products such as soup, sauce, puree, and tomato concentrate, is also an ally of the prostate gland. In one of my previous videos, I mentioned that consuming high amounts of lycopene can reduce the risk of prostate cancer. However, according to scientific data, lycopene also has implications in the case of prostate enlargement. I came across one study in which scientists administered 15 milligrams of lycopene per day to patients diagnosed with prostate enlargement for 6 months. It was found that those in the placebo group experienced an increase in prostate size, whereas those taking lycopene did not. Furthermore, those consuming lycopene experienced a significant improvement in health with the alleviation of symptoms. This 15 mg dose of lycopene can, of course, be obtained in the form of supplements. However, if you want to stick with food products, I can tell you how much tomato-based products you would need to consume to get this amount. 15 mg of lycopene is equivalent to about 2.5 tablespoons of tomato concentrate, 1.5 cups of tomato juice, 1 cup of tomato soup, or approximately 4 tomatoes. When it comes to nutrients that can support prostate health, it is worth mentioning omega-3 fatty acids, specifically docosahexaenoic acid and eicosapentaenoic acid. These compounds are naturally found in fatty fish such as wild salmon, sardines, or cod liver oil. In one of their studies, researchers observed that adding omega-3 to standard pharmacological treatment brings much better therapeutic effect than using medications alone. This just shows that even if we decide to take medications or it is deemed necessary, it is still worth remembering about natural solutions that can increase their effectiveness. For those interested in the mentioned experiment, a total of 900 mg of omega-3 were administered, divided into 3 doses per day for 6 months. Analyzing scientific literature, one can conclude that consuming onion and garlic is a good solution. Researchers observed that eating these vegetables was associated with a 35% lower risk of developing prostate enlargement. In another study, experts observed a decrease in prostate size after consuming garlic extract in people with prostate enlargement. Furthermore, the authors of the study reported a lower frequency of urination as well as an improvement in the rate of its flow. This only confirms that garlic can be a beneficial element in the diet of people struggling with this disease. So palmetto or sable palm is on the list of products with proven beneficial effects on men's health with benign prostatic hyperplasia. It is a plant originating from North America whose fruits were used by the native inhabitants of this continent to treat urinary and reproductive system problems. A number of published studies have clearly shown that the use of an extract from the fruits of the sable palm resulted in a reduction of symptoms in patients with mild prostate enlargement. For example, a reduction in the frequency of nighttime urination and an improvement in urine flow were observed. However, I must emphasize that sable palm does not reduce the size of the prostate itself. The beneficial effect of sable palm is due, among other things, to the fact that the compounds contained in it inhibit the activity of the enzyme I have mentioned several times, which converts testosterone into its more active form. What's more, the ingredients in this plant make the prostate less likely to capture testosterone and estrogen. As an interesting fact, an extract from the sable palm is used in some preparations specifically for people with mild prostate enlargement. It is worth emphasizing that these preparations, unlike other drugs, do not cause any side effects. Another plant-based resource that is quite exotic but can be helpful in the case of prostate enlargement is the African plum bark. More specifically, the extract prepared from it. As studies have shown, men taking the African plum tree bark extract often report an improvement in the alleviation of the disease's symptoms. For example, it was shown to reduce the frequency of nighttime urination by 19%, increase the flow of urine by 23%, and reduce the volume of urine retained in the bladder by 24%. What's more, similarly to sable palm, no side effects of using this plant were reported. These data only confirm that natural products, including plant-based products, have a great power that is worth taking advantage of, at least in the first instance and when the disease is not in an advanced stage. Health benefits can also be achieved by taking extracts from the root of stinging nettle. In one study, scientists observed a reduction in symptoms associated with prostate enlargement in over 80% of the patients. Additionally, in another experiment, a beneficial decrease in pro-inflammatory particles such as C-reactive protein or CRP and an increase in antioxidant activity in the blood due to the use of stinging nettle root extract by patients with the condition was observed. The improvement in the analyzed parameters is also a contribution to prostate health. Other products worth considering are pumpkin seeds and pumpkin seed oil. Studies conducted in Asia have shown that the use of pumpkin seed oil has improved the quality of life of men with enlarged prostate. An increase in urine flow was also noted. Similarly, there is substantial evidence in the scientific literature that suggests that consuming pumpkin seeds alone may also improve the health of those with enlarged prostates. A good element in the fight against prostate enlargement is also the reduction of body weight by people struggling with overweight and obesity, as excessive body weight promotes the development and progression of this disease. Therefore, it is worth being aware that losing a few extra pounds can bring significant health improvements. In this material, however, I will not be discussing how to lose weight. If you are interested in the topic of effective weight loss, you can find videos about it on my channel. As you can see, the cause of many unpleasant urinary system symptoms in men can be benign prostatic hyperplasia. However, in many cases, this problem can be solved by using the aforementioned natural methods. Of course, if the symptoms worsen, it is worth consulting a specialist to accurately diagnose the cause. I also encourage you to watch another video on my channel, the one about losing belly fat, which I mentioned today. To watch it, just click on the thumbnail that appeared on the screen. Thank you for your attention today, and I'll see you next time.